There is one quiet exercise, done lying down, that most women never hear about, and it can close a gap in your belly that has been open for decades. Let me show you what it is, why it works, and why the workouts you have been told to do may actually be making things worse. A study published in a major journal on postpartum recovery found that 60% of women have a separation of the abdominal muscles at 6 weeks after giving birth. About 45% still have it at 6 months. And a separate long-term study found that roughly 30% still have it 30 years later. That means the woman sitting next to you at the doctor's office, your sister, your daughter, your granddaughter, or maybe you yourself, could be carrying a small, invisible gap in the core that nobody ever talked about. The condition has a name. It is called Diastasis recti. And the most powerful exercise for it is not a crunch, it is not a plank, it is not a sit-up, it is a slow breath. The Cleveland Clinic, the Mayo Clinic, and physical therapy researchers at Ohio State Medical Center have all written about this condition. Programs like the Tupler technique, which was developed by a registered nurse named Julie Tupler and has been used by clinicians for more than 25 years, focus on a very specific muscle most people never learn about in regular fitness class. That muscle is called the transverse abdominis. Think of it as your body's natural corset, a deep belt of muscle that wraps around your middle like a tightened drawstring. When that inner belt wakes up and starts working again, the outer six-pack muscles are gently pulled back toward the center, and the gap begins to close. If this video helps even one person feel stronger and more comfortable in their own body, hit subscribe so this channel can keep reaching the people who need it most. And drop your age in the comments right now. I read every single one, and I want to know who I am talking to today. So let me explain what diastasis recti actually is, in plain words. Picture your six-pack muscles as two long, vertical curtains hanging right down the front of your belly. They sit side by side. Between them is a thin strip of connective tissue, almost like a seam in a piece of fabric. That seam has a name, too, the linea alba. In Latin, it just means white line. During pregnancy, as the baby grows, those two curtains are pushed outward and sideways, and the seam between them stretches. Sometimes the seam stretches so much that the two curtains end up 2, 3, or even 4 finger widths apart. That gap is the diastasis. Now here is the part that surprises most people. You can have diastasis and never feel pain. You can have diastasis and still have a flat-looking belly. You can have diastasis and not even know it, but you may notice other things. A small pooch or dome shape in your middle that will not go away, no matter how many crunches you do. Lower back pain that flares up when you carry groceries or pick something off the floor. A feeling of weakness in your core, like your middle is not holding you the way it used to. Maybe even some pelvic heaviness or urinary leaking when you laugh or sneeze. These are not signs that you are simply out of shape. These are signs that the deep inner muscle, that natural corset, is not doing its job, and the outer muscles are trying to compensate. Here is the mistake almost everyone makes. The mistake is doing crunches, sit-ups, bicycle kicks, Russian twists, and full planks. Because we have all been told that strong abs come from crunching. But think about what a crunch actually does. A crunch curls the two curtain muscles forward and pulls them tighter on the outside, while pushing everything in the middle, that stretched seam, outward, like a balloon being squeezed at both ends. Pillars of pressure push right against the weakest point in your core, which is exactly the gap you are trying to close. So every crunch you do, every sit-up you force out, every core-burning plank you hold, can actually make the gap wider, or at the very least, prevent it from closing. This is why so many women do hundreds of crunches a day, year after year, and the belly pooch never changes. The exercise that changes everything is shockingly gentle. It is called diaphragmatic breathing with transverse abdominis engagement. Some therapists call it 90-90 breathing, because both your knees and your hips are at 90-degree angles. Others call it belly breath, or TVA breathing. The name does not matter. What matters is the movement. Let me walk you through it step by step, right now, in a way you can do this evening in your own bed. Lie down on your back. Bend your knees. Place your feet flat on the bed or the floor, hip-width apart, with your knees bent to about 90 degrees. You can rest your feet on a chair, a couch, or even a stack of pillows if lying flat feels uncomfortable. That is perfectly fine. Rest your hands gently on your lower belly, right where the two curtain muscles meet, just above your pubic bone. Now take a slow breath in through your nose. As you breathe in, your belly should gently rise under your hands, like a balloon filling with air. Let it rise. Do not force anything. Then, as you slowly breathe out through pursed lips, like you are softly blowing out a candle, gently draw your belly button down toward your spine. Imagine you are zipping up a tight pair of jeans from the bottom up. The lower belly tightens first, then the middle. The outer six-pack muscles should stay soft. You should not see a bulge or a ridge down the center. If you see a ridge or a tenting along the middle, that is a sign you are using the outer muscles, and you want to back off and try again, softer. That is 1 rep, a rep that takes about 6 to 8 seconds. 10 of those, 2 or 3 times a day, is where the real healing begins. Here is the analogy I want you to remember. Think of the linea alba, that stretched seam, as a worn-out bridge between 2 cliffs. For years, everyone has been sending heavy trucks, the crunches, the planks, the twisting exercises, bouncing across that bridge. Of course it does not heal. What we want is light, careful traffic. Footsteps from a small, gentle pedestrian. The breath is that pedestrian. It wakes up the deep inner muscle, the natural corset underneath, and that corset, once it is strong again, becomes the support structure that takes the load off the bridge. The bridge does not get stronger because you are attacking it from the outside. It gets stronger because you are finally supporting it from the inside. Now let me tell you about Margaret. Margaret is 62 years old. She had her 2 children in her early 30s, almost 30 years ago. For decades, she blamed herself for what she called her mommy tummy. She tried every ab workout on television. She bought the belts, the wraps, the creams. Nothing worked. She started avoiding fitted clothes. She hated seeing herself in profile. Then her daughter, who had just had a baby, was diagnosed with diastasis recti after seeing a pelvic floor physical therapist. Margaret went along to the appointment for moral support. The therapist, a kind woman named Dr. Patel, asked Margaret if she herself had ever been checked. Margaret almost laughed, but she lay down on the table, and Dr. Patel pressed 2 fingers gently into her belly and asked her to lift her head. Margaret felt a gap 2 fingers wide, still there, 30 years later. The therapist showed her the 90-90 breath. Margaret did it for 10 minutes that day. She kept doing it every morning and every night. Within 4 months, her gap had narrowed to less than 1 finger width. Her back pain, which had troubled her for 20 years, eased. She did not lose weight. She did not get a six-pack. What she got back was function. And for Margaret, that felt like a small miracle, even though it was really just consistent, patient, gentle work. Now, the 90-90 breath is the foundation. But there are a few other moves that pair beautifully with it, once you have mastered the breath. I want to walk you through 4 of them, slowly, so you can picture exactly what each one looks like. The first supporting exercise is the heel slide. Stay on your back, knees bent, feet flat. Breathe in through your nose. As you breathe out and gently draw the belly inward, slowly slide one heel along the bed or the floor until your leg is almost straight. Then breathe back in as you bring the heel home. Repeat on the other side. The move is not about working the leg. It is about coordinating the deep breath with the gentle tightening of the inner corset. Think of it as sliding a drawer in and out very slowly. The breath is the slide, the corset is the rail keeping everything aligned. The second supporting exercise is the toe tap. Same starting position. Breathe in. As you breathe out and draw the belly in, lift one foot just an inch off the floor and tap the toe down lightly. Bring it back up. Breathe in as you reset. Switch sides. This one is harder than it sounds. Do not rush it. The goal is not to see how many reps you can cram in. The goal is to feel the corset stay on. Every breath is a chance to feel the inner muscle light up, and every tap is a chance to keep that light on while you move. If the belly bulges outward, or you feel strain in your neck, you are moving too fast or doing too much. Just slow down. The third supporting exercise is the glute bridge. Still on your back, knees bent, feet flat and hip width apart. Breathe in. As you breathe out and gently draw the belly in, slowly lift your hips a few inches off the floor. Just enough that your body makes a straight line from your knees to your shoulders. Hold for one breath. Breathe in as you lower back down. The bridge is not about lifting heavy. It is about teaching the pelvis and the deep core to work together. Picture a small table. Your hips are the middle of the table. Your shoulders and feet are the 4 legs. When you lift the hips, the table becomes stable. When the table is stable, everything sitting on top of it, your spine, your organs, your lower back, feels more supported. The fourth supporting exercise is the bird dog. This one is done on your hands and knees. Make sure your hands are directly under your shoulders and your knees are directly under your hips. Keep your back in a flat, neutral position, like a tabletop. Breathe in. As you breathe out and gently draw the belly in, slowly extend one arm forward and the opposite leg straight back, just to hip height. Do not swing, do not arch. Hold for one breath. Come back. Switch sides. The bird dog is like carrying a full tray of water glasses across a room. Any wobble and the water spills. Your deep corset is what keeps the tray steady. When you practice bird dog while breathing, you are training that inner corset to hold steady under gentle movement, the way we need it to hold steady when we bend, twist, and lift in real life. Now, a quick word on how to know if these moves are working. There is a simple self-test you can do at home, and it is the same test a physical therapist would do. Lie on your back with your knees bent. Place 2 or 3 fingertips just above your belly button, fingers pointing down toward your pubic bone. Relax your belly. Then, gently lift your head off the floor. Just an inch, the way you would at the start of a crunch. But stop right there. Feel what happens under your fingers. If the fingers sink down into a soft gap, that gap is your diastasis. If your fingers feel pressed outward by a strong ridge, that ridge is the linea alba pushing up, because the inner muscle is not engaging yet. Either observation tells you something useful. You can repeat this test once a month, gently, just to track progress. A narrowing gap or a softening ridge is exactly what we are looking for. Now, an important habit that often gets overlooked. Many physical therapists who specialize in postpartum recovery recommend wearing a light abdominal splint or wrap during the early healing weeks. Not a tight shapewear corset, not a waist trainer, but a soft, supportive binder that gently holds the outer muscles toward the center while you do your breath work. Think of it like a gentle hug around the middle. This is not a forever thing. It is a temporary support while the inner muscle is waking up and remembering its job. If you want to try one, talk to your doctor or your physical therapist about which kind is right for your body. Let me address a debate that comes up in the comments of every single video on this topic. Some of you are going to swear that crunches healed your diastasis. Others are going to swear that crunches made it worse. I want to hear both sides. Tell me your story in the comments below, because this is not a one-size-fits-all situation. For some women, very early in recovery, with very gentle form and no bulging, certain moves can be okay. For many others, especially years out from childbirth, the same moves are pushing that stretched seam wider every single day. The fact that you disagree is exactly why I made this video. Let's get the truth out in the open, together. And here is another debate for the comments. Some of you watching are 60, 70, even 80 years old, and you are watching on behalf of your daughter. Some of you are watching because you yourself had children 40 years ago, and you have had a belly pooch you were quietly ashamed of every single day. Drop a comment and tell me, are you watching for yourself or for someone you love? I read every comment, and I want this channel to be a place where you feel seen. Now let me give you the simplest possible recap so you can remember everything we covered even if you only caught half the video. Diastasis recti is the separation of the 2 long abdominal muscles along the seam between them, often caused by pregnancy, but sometimes by major weight changes, abdominal surgery, or chronic straining. It is far more common than most people realize, and it can persist for decades if it is never addressed. The biggest mistake people make is trying to fix it with crunches, sit-ups, and full planks, which can actually push the gap wider. The single best exercise to begin healing is the 90-90 diaphragmatic breath, done lying on the back with knees bent, where you breathe in to let the belly rise, then breathe out, gently drawing the belly button toward the spine. 10 reps, 2 or 3 times a day. The 4 supporting moves to add, once you have the breath down, are the heel slide, the toe tap, the glute bridge, and the bird dog, each one coordinated with that slow, soft breath. A simple self-test with 2 or 3 fingertips above the belly button can help you track your progress month by month. And a soft abdominal splint can give you gentle external support during the early weeks of healing. The single most important thing to remember is this: healing is not about force. Healing is about consistency. 10 slow breaths a day, done correctly, will do more for your core than 1,000 forced crunches done wrong. Before we close, a brief but important safety note. The information in this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you have abdominal pain, a hernia, recent surgery, are pregnant, or are dealing with any diagnosed condition, please talk to your doctor or a pelvic floor physical therapist before beginning any new exercise program, especially if you take medications that affect blood pressure or healing. Natural and gentle does not automatically mean risk-free for every person. Your body, your history, and your doctor's advice should always come first. If this video gave you one new idea, one new breath, one new image of your inner corset waking up, please subscribe. We are building a channel that helps millions of people stay strong, mobile, and confident as they age, and we are just getting started. Hit the bell so you do not miss a single new video. And here is what is coming next. If diastasis recti is the gap in the front of your core, weak pelvic floor muscles are the hidden problem underneath. They are the muscles that hold everything from below, and they are just as fixable, with just as simple a routine. In the next video, I am going to walk you through the 5 gentle pelvic floor exercises that can change bladder control, lower back comfort, and core strength from the inside out. If that sounds like something you or someone you love needs, subscribe now and tap the bell. See you in the next one.